To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hi, and welcome to Your Health. It is annual enrollment season for Medicare, and a lot of questions come up. There can be changes to plans. You're not sure what to select. We have Aaaron Wallender, who's a licensed Medicare specialist with Northern Advantage Insurance here today to answer a lot of those questions. So let's start at the beginning. How do we set up a Medicare account?
Yeah, so when you're first starting Medicare, the simplest way is to go onto the socialsecurity.gov website.
Okay.
They have a very simple to follow process where you just click through, selecting your Medicare benefits. You set up your account on there, and then you get once you enroll in Medicare, you get a card and all that kind of stuff in the mail.
Okay, so you've just turned 65. You can go onto that website and get all set up.
Correct.
Okay.
Usually you want to do that just a couple months prior to turning 65,
Okay.
so that your card arrives on the month you turn, before the month you turn 65.
Gotcha. All right, so is like an annual physical included in Medicare, things like that, all those kind of preventative things?
So there are preventative services under Medicare coverage. However, an annual physical is actually only covered one time at the beginning of your Medicare lifetime. So
Okay.
when you're turning 65, for example, you'll get a physical that year, but in subsequent years, they transition to what they call a wellness exam.
Okay.
So it's not a full physical. That being said, there are some other options that would cover a full physical. So that's why it's good to talk to somebody like me to see how you can get that covered.
Absolutely. Okay, so let's say you like to travel a lot. Does Medicare cover you if you travel a whole bunch?
Yep, so Medicare is a nationwide benefit, and in some limited circumstances outside the country as well. But if you're within the United States, and you have Medicare, you can typically go to any provider that accepts Medicare payment. Now, depending on the type of coverage you have to kind of take that into account if you do a lot of traveling, because
Okay.
some plans do limit you geographically a little bit.
Okay.
So again, something to take into account when you're meeting with a broker and going over your options.
Definitely. What happens if you would move to a different state?
Sure. So when you move to a different state, your Medicare will follow you, but your plan that you choose to go along with your Medicare, whether that be a Medicare Advantage or a Medicare Supplement or prescription drug plan, you may have to change that based on where you move to. Some plans are based on geography and the zip code that you live in. So again, if you move from, like, say, Wisconsin to Illinois, you
Yep.
most likely would have to change your coverage.
Okay. And then I guess to get your help, to have a specialist help us make all of these selections, is there a fee?
There's not a fee. My services are always free. So, of course, I encourage everybody to utilize those services, or whether it's myself or another broker, we don't charge for those consultations. So if you need help, we're a free resource and definitely something you should take advantage of.
Great information. Thanks so much. And thank you for watching To Your Health.
The preceding was a paid advertisement.